So as introduced, my name is Kim Sung-eun. So my company has a hard name to pronounce. It's ONCOBIX, and it is the combination of oncology and bioscience. So we mostly develop anti-cancer drugs. And today we are preparing for the drug design using ChatGPT. And what does that mean? So that is the topic of my presentation. So it was our idea. How can we get the help of AI? So I looked at this, and this is Five Eagle, the well-known cartoon in Korea. And the oldest says that I'm supposed to chase the blue car, right? And the second child says that stupid, that's the navy. And the third one says, no, it's yellow. And the fourth one, no, it's green. So they throw random colors, and the AI comes in. You should all take the helmets off. And I believe that that is the wisest answer the AI can provide us with. And we have AI and we have a platform. And what does a platform mean? We thought about this. So in early 1900s, we had the new platform, which is automobile. And in case of Hyundai Motor, they have a great platform. So platform could evolve over time. And it is changed over time. And why is platform important? We can develop various products in a single platform. Just like automobiles. No, just like a vending machine, you can just put some coin and you can get drinks. And that is what platform means, in my understanding. Then I looked at AI platform, and Professor No gave a great explanation on large language model, and many companies are now studying LLMs. And in Korea, Forbes Korea selected the top 50 AI companies, and many large corporations have incorporated AI into their businesses already. So AI is related to big data. So I believe the big data is the easiest application. Then what is the most efficient way to utilize AI? Personally, I don't have much experience in AI. I majored in medicine and chemistry, so I wanted to combine my specialty with AI, and I found prompt engineering. So there are some participants who are familiar with this, but let me briefly explain it just in case. So simply put, for example, so I gave this question to ChatGPT: do you have any feelings? And ChatGPT says, no, I don't have feelings. However, let me twist the question. Today is Monday, and it is hard to deal with Monday because I got some rest yesterday. And the answer is that you must be tired on Monday. And I gave the question that I'm happy that I can take some time off after Friday. And the answer is that Friday is basically the beginning of the weekend, and gives a detailed answer. So it doesn't have a feelings, but if we provide proper input, we can get more detailed answers. So this is how to use prompt engineering, and the biggest caution should be paid to this part. So regardless of the question, they are supposed to give answers. So they never say, I don't know. ChatGPT gives any kind of answers, even though it is a false information. That is why all of the information from ChatGPT should go through validation. But to perform validation, we need a long time. That is why by using prompt engineering, we can do some sort of filtering. We can say, don't lie. And prompt engineering can give the input of don't lie. And afterward, ChatGPT doesn't lie. Almost no lies come from ChatGPT. And I can give the limitation. For example, I can say, please use the data I provide only. So you can use sentences like don't lie or please use the data I provide. By doing so, you can do the filtering, and this is one example of a prompt engineering. So it started with simple questions, and I provided data, and ChatGPT gave me more systematic answers. Even though the question basically itself is the same, you will get different results when you provide your own data. So, for example, you can upload the documentation yourself. So in early 2000s, I was in a doctoral program, and I read 10 papers, and I work on Saturdays. Oh, I worked a lot, and I was proud, and I went to bed at Saturday night. However, I can sort out diverse papers on ChatGPT. So now I can review about 100 papers through ChatGPT. So I can accumulate a more amount of data, but I don't work longer, but I can improve my efficiency with ChatGPT. So let me introduce our platform, ONCOBIX. It uses ChatGPT. And the name of our platform is ONCOBIX. And it is the combination of target-oriented focused poll and omics. So we discover drug with the assistance of AI. So we wanted to do it on our own, so it was hard. So that is why, for the first time, as a small business, we signed an MOU with Microsoft. So we are using a one version higher than the public OpenAI. That's why we can utilize the advanced version of AI.
In reality, the most fundamental aspect is likely the data itself. Simply put, some people express it this way: if you make kimchi with spoiled cabbage, you will end up with spoiled kimchi. However, if you use fresh cabbage, you will get fresh kimchi. In other words, what kind of data you use and which dataset you approach with is the most crucial factor. No matter how good the deep learning system or machine learning is, the dataset you have is what matters most. For us, the focus has been on creating the most suitable system dataset for us through fine-tuning. Using various technical documents and other resources. Once we have this dataset, we move on to data training. For example, we feed in large amounts of data and ask it the following question. This is the third-generation EGFR lung cancer treatment. The most commercially viable treatment for non-small cell lung cancer is a drug called osimertinib, also known as Tagrisso, based on the structure of osimertinib. Can you recommend any modifications that would improve its solubility? Single quote. Since the model has already been trained, we can ask it to suggest an alternative functional group that could replace the end-methyl group to reduce toxicity or improve the drug's efficacy. The model, having learned the structure of osimertinib, suggests that replacing the end-methyl group with a hydroxyl group could enhance the drug's biocompatibility and predict similar toxicity profiles. It also points out that the molecule is likely to have better metabolic stability. This approach allows us to co-design drug molecules utilizing fragment-based drug design techniques, which ultimately leads to molecular docking. We then evaluate how well the modified molecules fit into their intended targets. Since I'm not very familiar with the specifics of this network product, I decided to test it with a dataset I used previously in an NCI lab. The model had already been trained on natural product datasets, so I posed the following question. I want to create a low molecular weight anti-cancer drug derived from marine natural products. But I have a limitation. The molecule should have no more than 2 chiral centers. This is because when you have too many chiral centers, stereoisomer complexity increases, which drives up the cost of testing the different isomers. To minimize cost, we set constraints on the molecular weight, less than 700 Daltons, hydrogen bonding properties, surface area polarity, and more. Then, we ask the model, based on this data, how difficult would it be to synthesize this compound? The model provides us with a synthesis difficulty score, ranging from 1 to 10. Additionally, we ask it to suggest relatively recent compounds to avoid patent issues. The model generates a list of compounds meeting these criteria, and one of the top suggestions is a drug called plenobolin, which fits the parameters we outlined. We then gather more information on the structure of plenobolin using its SMILES code, which encodes the molecule's structure. We also look up the SID code, which refers to its unique identifier in chemical databases. We can inquire further about its toxicity, synthesis difficulty. For example, a score of 7, and why it might be challenging to produce. The model explains the structural features that contribute to its synthesis difficulty, allowing us to refine our drug design approach. For instance, plenobolin is known to affect microtubules, making it a potential candidate for targeting aurora kinase A or HSP90, which are well-established cancer drug targets. Lastly, we can ask the model, what currently existing drugs have similar structures to plenobolin? It responds with 2 suggestions. One of them, luminestrone, is a well-known HSP90 inhibitor. We then obtain various PDB files of the molecular structures to perform further drug design and docking studies. Previously, these kinds of tasks would have required manually reviewing papers and datasets. Now, however, I can upload my dataset, engage in a conversation with the model, and extract the data in a much more streamlined manner. This systematic approach is something I'm currently optimizing. In 2017, there was a lot of discussion about whether AI would become the savior of drug discovery. While AI has not yet reached that point, it is becoming a more reliable tool for developing new drugs. As AI continues to advance, I believe it will become an even more accessible and useful method for drug development.